have to wait any longer. I'm Gray Krause, Professor Emeritus of Biology and Director of the Emeritus College, and I'm very pleased to welcome you here today. This seminar will be recorded and then it will be posted on our website so it can be viewed later if you want to look at it again or you have colleagues who would like to see it. We have several of our members here today who are going to tell you about various parts of our activities and answer questions that I don't know the answer to, and that's why it's so nice to have them here. Those are Helen O'Shea, who's Professor Emeritus of Nursing, and she's going to talk about our retirement mentoring program. Gretchen Schultz, who's Professor Emeritus of English at Oxford, and she'll probably say something about our lunch colloquiums and other programs. Jim Keller, who's Professor Emeritus of Radiation Oncology, and he's my backup on any issues of healthcare, and he's the one who has done so much work to develop our program on that. And then I think Mike Kuttner, who's Rollins Professor in the Department of Biostatistics and Bioinformatics, will be here. So for the program today, I'm first going to give an overview of healthcare choices that you have to make in retirement. And then Helen is going to talk about a retirement mentoring program, and I'll talk about Emeritus Status and how that's obtained. And then we'll have a discussion of various other programs that we have and plenty of time for questions and answers. And certainly during my presentation and others, if you have questions, there'll be a time for questions at the end, but if you have questions during it, go ahead and ask those questions. And we use the Zoom raise hand function. And if you've updated Zoom in the last months, at the bottom of your Zoom screen, there's a reactions icon. And if you click on reactions, there will be an icon to raise hand. And that lets us know that you're asking a question. And certainly while I'm talking, Diane Beck, administrative assistant in the Emeritus College, will be monitoring that and let me know if someone's asking a question, because it's difficult to talk and pay attention to that. And if for some reason you can't find the raise hand function, you can send a chat to me to let me know that you have a question. So before I start, I want to do a poll of 3 questions. And first of all, this is an anonymous poll. It means that no one will know what response you're giving, and that includes me. I'll have no idea who has said it, and I'm not even going to save the answers. The reason for asking these questions is because it's going to help us know what our audience is. And the first 2 questions in particular have bearings on healthcare choices. Okay, so I'm going to go ahead and stop the poll, and then I'll share the results so that you can see what how people have responded. And so there are several who are planning to retire before age 65. And I saw that response, and so I had time to modify my PowerPoint, so that was useful. And then there are a number who were hired on or after January 1st, 2003. That turns out to be a critical date. And then there's a variety of responses from retiring within the year to probably more than 5 years. And so that's useful to know. And certainly in terms of retirement mentoring, it's not really too early, even if you're 5 years out, to think about retirement mentoring. So I'm going to stop those results, and then I will start what I'm going to say about retiree healthcare. So this is a complex subject. I'm going to give an overview, which is relatively brief. We have a healthcare newsletter which explains in a lot more detail all of this. And so there'll be a chance to ask questions now, but those of you who haven't gotten our healthcare newsletter, will be able to get that and see more reasoning of why we did this. Now, here is a slide that I wasn't planning to show if it weren't needed, but it is needed because several of you are planning on retiring before age 65. And so why does that matter? Because if you retire before age 65, but still want health care, you can get the Emory University healthcare plan. It is very expensive. As you can see, if you're non-Medicare eligible, so that means you're younger than 65, and you were hired prior to January 1st, 2003, the cost of your health insurance would be $708.73 per month. If you have a spouse, the cost of your health insurance would be $1,417.43 per month. Now, why is January 1st, 2003 such an important date? There was, during an earlier financial crisis, there was a fairly severe cut made in various retiree benefits. And one of those retiree benefits was retiree health care. And so after that point, there was basically no funds provided for any sort of retiree health care. And let me say, I'm the messenger in this. I'm not defending it, I'm only explaining it, so don't blame me. But if you were hired on or after January 1st, 2003, the price you would pay for health insurance is, instead of $708, it's $1,294 per month. And for a spouse, $2,588. Now you see that's without subsidy. So the idea is that with health care before 65, you're paying $708, but that still is being subsidized by the university. And so the price without any subsidy is $1,294. And so it's important to understand that retiring before age 65 when you're not eligible for Medicare turns out to be very expensive. And so you just need to know that in terms of financial planning. You know, the thing is, most faculty can probably manage to afford this. If you think about staff wanting to retire before age 65, and particularly staff who've been working at fairly low wage jobs, this becomes a huge problem and is really something that puts them in a great deal of financial stress. Now, in terms of health insurance for those who retire at age 65 or greater, Medicare becomes the primary insurance. And Medicare Parts A and B is sort of the Medicare program for health care, not counting drug care. That is not sufficient coverage. And so you will definitely want additional coverage on top of Medicare Parts A and B. There are two basic forms of supplemental health insurance: Medigap plans and Medicare Advantage plans. And I'm going to talk about both of those in a minute and their differences. Now, it's important to understand that these plans are sold by insurance companies and they make money from selling them. And so once you turn 65 or begin to turn 65, you'll probably get lots of mail from individual plans and from companies that sell many different plans, telling you why you need to buy insurance and particularly buy the insurance that they're selling. And it's important to understand that their main concern is making money and not necessarily what is best for you. So you just need to be prepared for that. Now, the choice of Medicare supplemental plans is really complex. And for human resources at Emory to have been able to have the knowledge and ability to advise faculty on what to get and so forth would have been enormously expensive in terms of personnel. And so they, like most universities in similar situations, have made arrangements with other companies to help retiring employees choose a healthcare plan. And in Emory's case, that's a company called Via Benefits. Now that service is free for employees. In other words, you can, and you'll probably start getting phone calls and so forth from Via Benefits as you turn retirement age to talk with them and sign up and so forth. So their service is free, but I think most of us understand that free means somebody is paying somehow. And so they, of course, get their compensation from companies that will pay them to represent their products. Via Benefits does not offer all available plans. Some plans they don't offer because they think they are not good. And I think some of us suspect that some plans they don't offer because they don't get commissions. One thing to understand is you do not have to get any of your health insurance plans through Via Benefits. You can go directly to companies, and that's fine. So you're not required to go through them. And I will say that a number of our members have found it much easier and less hassle to contact a company directly rather than go through Via Benefits. To make things more complicated, Emory Healthcare has contracted with a company called Medicare Compare USA to provide help to Emory Healthcare patients to choose a Medicare plan. And many of us, I suspect, are patients of Emory Healthcare. So you may well get information from Medicare Compare USA willing to provide help. And that service is also free. And Medicare Compare USA also gets their compensation from selling policies. A number of us have looked at that, and it seems that Medicare Compare USA seems to be very biased towards selling Medicare Advantage plans. After we made some complaints to to Emory Healthcare, they seem to be better at efforts to avoid confusing Emory retirees, because Emory retirees have Via Benefits to help them, and so there is no real reason to make use of Medicare Compare USA. And as I will explain, most of you will need to have some association with Via Benefits anyway. Now, what is the difference between Medigap and Medicare Advantage plans? For Medigap, if you have a Medigap plan, it's accepted by any provider that takes Medicare. And all of Emory Healthcare takes Medicare. Most healthcare providers take Medicare. And any of those that do will accept any Medigap plan. Medigap plans themselves do not have provisions for drugs. So you also need to get a Part D drug plan. So if you have a Medigap plan, you also have to get a Part D drug plan. The Medigap plans, when you look at them, there are many different plans and different levels of coverage. There are plans A, B, C, D, F, G, K, L, M, and N. And then there are a lot of companies offering some of those plans. And so it can appear very confusing. And that's one of the things that we try to help with in wading through that alphabet. By law, any plan X, that is a plan A or a plan D, et cetera, must be the same no matter what company offers it. So they must provide the same level of coverage and so forth. And most Medigap plans have some coverage for foreign travel. Now, Medicare Advantage is a quite different model. Medicare Advantage plans generally will have a provider network. And so if you have a Medicare Advantage plan, it's only accepted then by a provider that is in network. So you have to worry about whether a provider that you want is in your Medicare Advantage network or not. Medicare Advantage plans offer a number of things which seem to be really nice benefits, sometimes sort of fitness things, maybe vision insurance and so forth, that can appear appealing. They generally include a drug plan, and that's can be either a plus or minus, and I'll talk more about drug plans, but part of the issue is that every drug provider has their own formulary. And so if you have a Medicare Advantage plan, you are then hooked into the formulary that they have in terms of what drugs they will provide and at what cost. The cost of Medicare Advantage will generally be lower than Medigap plans if you don't use many healthcare services. So you can find Medicare Advantage plans that have no extra fees. But of course, then there will be large copays and so forth. And usually there's no coverage in foreign countries. So one thing that is important to understand is that it's in general difficult to switch plans after your initial choice. If you decide you want to switch plans, you can be denied, or you can be charged higher premiums to choose a plan. So you can't sort of choose richer plans as you get older. That is, you can't choose a very basic Medigap plan and then say, well, you know, I'm getting older, so I need more services. I better get a better plan that has better coverage. That generally doesn't work. So it's important to choose the type of plan and the company carefully upon your first enrollment, because it's not easy to switch. Another thing is that either type of plan is per person and not per family. So in Medicare coverage, there's no family plan. You and your spouse will have to choose a plan, and usually for Medigap and Medicare Advantage, it will be the same plan. That's not true of drug plans, however, necessarily. Now, the bottom line is that our recommendation is for faculty, because most faculty can afford it, a Medigap plan is preferable. The newsletter has a lot more reasoning why we say that. I'm not going to go into all of that now. And I think it's true that most of our members have a Medigap Plan F. That's the richest plan in that it's most expenses are covered. So it's clearly the one that costs the most, but it also has the greatest coverage. However, Medigap Plan C and F were phased out in 2020 for people initially choosing them. So that means that someone at 65 now can no longer choose a Plan F, though if a person is retiring at an older age and they were eligible when they were first 65, they could get a Plan F. So a number of you would still be able to get Plan F. But it looks like Medigap Plan G is likely to be a more attractive option for most faculty retiring now. And in terms of all these plans, this is a chart that lists the coverage of the various plans A, B, C, D, F, G, K, L, M, and N. And the two that I was talking about are F and G. And F is being phased out. G is available. And if you look, they are all the same, except that Plan G does not pay for the Part B deductible. Now, the Part B deductible is $203 a year, so that's the only difference. Plan F is being phased out because Congress felt that those getting Medicare should have somewhat more skin in the game, and that was, they felt too rich. And so Plan G is the one that pays the most after Plan F. Now, so when should one apply for Medicare Part A? Here is what is in the Medicare and You booklet. And basically what that says is that you can enroll in Medicare Part A anytime past the age of 65, as long as you're still covered in an employer plan. So technically, there's no reason that either you or your spouse who is on your plan but not employed at Emory should have to apply for Medicare Part A until you retire. However, recently there have been some problems that one or two faculty who had, particularly in cases where their spouse was on their plan but past age 65 and had not applied for Medicare Part A, Aetna was giving them problems about coverage. After a lot of back and forth and hassle, that was worked out because Aetna should not have been doing that. I only mention that because it's free to sign up for Medicare Part A. You might avoid some hassles if you do that. The disadvantage is that you can no longer have an HSA, I think that's the right acronym, plan if you're in Medicare Part, if you signed up for Medicare Part A. Now, in terms of applying for Medicare Part B and either a Medigap or Medicare Advantage plans, that is much clearer and there's no real debate about that. You will not apply for Medicare Part B or a Medigap, for Medicare Part B and a Medigap or a Medicare Advantage plan until your retirement date. So once you retire, you would apply for those. And although the open enrollment period where you can apply without underwriting extends something like 6 months past your retirement date, you actually want to sign up in advance so that you will have your coverage on the date that you retire. Now, the cost of Medigap plans actually varies. One would think that, well, if a plan has to cover all the same cost, then no matter where you get a Medigap plan, it should cost the same, and that's not at all true. Some companies, such as USAA, don't pay a fee to sellers, and so they're only offered directly to consumers, and those tend to be somewhat less expensive. And Via Benefits in the past, and I'm not sure if that's still true, doesn't offer the USAA plans. Now, if with Plan F no longer being offered to new enrollees, Plan G is the one that is the same except for the deductible of $203 a year. So one would expect then that the premium difference between a Plan F and a Plan G would be very slight because they're paying the same thing except for the deductible. And that turns out not to be the case. So here are three companies, and it's I might say turning out to be more and more difficult to actually find these numbers. Lots of companies want you to sign up before they even give their rates. But at age 65, if you're looking, you only can get a Plan G. However, if you're age 70, you can still get a Plan F or a Plan G. And what one can see is that the yearly savings are, for the most part, incredibly different. So for the AARP United Healthcare, Plan F and Plan G, the difference is $1,000 savings in a Plan G compared to Plan F. And likely that's due to the demographics of the populations that are enrolled. And that partly probably could explain some of the differences between companies and their charges for, so Blue Cross Blue Shield charges $158 per month for Plan G at age 70, whereas USAA is $199. And that probably has to do partly with the demographics of their plans. The the difficulty in looking at these numbers and say, well, shouldn't I choose the plan that is the cheapest? The problem is that a plan is not guaranteed to have the same relative cost in upcoming years. If their populations changed and if their demographics changed, they could raise their rates more than another company. So one has to be careful about choosing just the cheapest plan and asking rather how likely it is will they keep their premiums relatively in line with others. Now, if you have a Medigap plan, you also need to get a drug plan to pay for drugs. And this is becoming more and more complicated and is really such an excellent indication of why our healthcare system is so broken. First of all, unlike Medigap plans, Part D drug plans can be changed yearly, and you will actually want to look every year to see if you need to change it, because the formularies could change from year to year with these companies. And so you could look at the drugs you're taking this year and choose a plan, but those same drugs the next year might be less expensive with another company. If you don't take many drugs now, you say, well, I don't need a Part D drug plan, I'll just wait to get one later. There's a penalty imposed forever if you fail to purchase a Part D plan upon initial enrollment. So you'll want to get a Part D plan if you're getting a Medigap plan, and just get the cheapest one possible so you don't have to pay a penalty later. Each plan has a different formulary that can be very complex. There's an example of an Emory MD who was actually in good health, but was taking 12 different drugs, and there was no company available that had all of those drugs in their formulary. So he had to choose a plan that worked best and then pay the rest out of pocket, which is just an example of how difficult this can be. And our newsletter goes into a lot more explanation of the difficulty of these plans. And this is a case in which your spouse could very well have a different Part D drug plan. You would probably want the same Medigap plan, but your Part D plans could vary depending on the drugs that you took. And as I say, this is becoming an increasingly complex decision, because you can fairly easily choose the best plan for the drugs you take now, but then the question becomes, what about next year? And you likely don't know what you'll need to take next year, and then the choice becomes much more difficult. Now, here is another place in which your hire date becomes important. For those hired before 2003 and who have maintained Emory healthcare coverage until their retirement, you get a subsidy for Medicare and health care cost in retirement. And that's currently $126.54 per person per month. So if you and your spouse were both on an Emory healthcare plan until you retired, and you were hired before 2003, you can expect to get that subsidy for the rest of your life per month for any sort of healthcare cost. That subsidy is obtained through VIA benefits, but you don't have to have you don't have to buy any policies through VIA benefits, but that's why you'll want to have VIA benefits coverage. VIA benefits at least have an account with them. Another factor also is that another part of that Emory benefit is catastrophic drug coverage. So catastrophic drug coverage begins after $6,350 in out-of-pocket drug costs per year. And in that case, the Part D plans will pay 95% of your drug costs. And that sounds, wow, well, I only have to pay 5% after that. However, if you're taking very expensive drugs, that 5% can be a very large amount. And so the catastrophic drug coverage in general only affects a few Emory retirees per year, but those that it does can provide a very large benefit. If you were hired on January 1st, 2003 or after, you do not get this subsidy and you do not get the catastrophic drug coverage. Also, and this is where the retirement date fits in, if you retire before age 65, but you don't continue the Emory healthcare coverage, you say the Emory healthcare coverage is too expensive, I'll get something else, then you lose your chance at getting this subsidy once you turn age 65. So you just need to be aware of that. And again, I'm just the messenger about this. So I will turn things over to Helen O'Shea, who will talk about a retirement mentoring program.
Okay. I'm Helen O'Shea. I'm the chair of the Pre-Retirement Mentoring Committee for the Emeritus College. And I would say, so what is pre-retirement mentoring? And how long has this been around? The university and the Emeritus College have been doing seminars, sort of like the one we're doing now, plus one on finances, and there's one on psychological and emotional aspects of retirement. And they're large group seminars when we could do those, or they're big Zoom meetings since we can't. But the pre-retirement mentoring is a one-on-one kind of operation, and it was designed within the Emeritus College in cooperation with faculty staff assistants. And so the training for the mentors is done in collaboration with faculty staff assistants. So recognizing that as you consider retirement, you may well wonder or be worried about how are you going to cope when you leave what for many of you has been your life's work, the way you identify yourself, and the way you see other people as identifying you. So the unspoken question is, or statement is, I don't know what I would do all day if I weren't going to Emory. So we believe that pre-retirement mentoring can help you answer that question, because what it amounts to is one-on-one confidential conversations with a peer, a faculty peer who is happily retired. And most of us who are retired are quite happy at it. And can help you realize that there is life after retirement. When you're thinking about retirement, when do I want to do it? Am I ready? Am I not ready? It's, to retire or not to retire. You know that if you don't retire, there are things that you're familiar with. There's teaching, mentoring, committee work, faculty and committee meetings. Well, there were when we could do that, but I'm sure you're still doing them on Zoom. Annual evaluations, what fun. Writing for publications, getting the grant money in order to keep the size office you like. I'm great. Predictable schedules for semesters and academic breaks, a monthly paycheck, which is very nice, health insurance, which Gray has talked about, and then a monthly retirement contribution, your own in the universities. So if you do retire, then you can only project what life will be like. You know what you're retiring from, but have you thought about what you're retiring to? What will I do all day is a serious concern. Who will I be is another serious concern. Ideally, we would like the potential retiree to be able to say with some conviction, this job is what I did. It is not who I am. So things your mentor can help you consider. First, the idea of having to clean out an office. And if you've been in your office for many years, let me tell you, that is no small feat. I was at Emory for 40 years. We won't talk about office cleaning. They'll help you think about what you would do if you had the time. How many times have you said, if I had the time, I would fill in the blank? For example, travel, when we can do that again, when you want to and wherever you want to go, and not just because there's a meeting there that you're going to attend. You can read whatever you want to read, whenever you want to read it. You can learn a new skill. You might want to take up music, art, woodworking, cooking, gardening, improve your golf game, learn a new language. The thing is that you're in charge of how you spend your time. And it gives you time to take care of yourself, because taking care of yourself is not selfish. You have to think about who will be in your social network and who's going to be part of your emotional safety net, because you're not going to have your office mates or the people down the hall. Do you rent or own your house or apartment? Are you thinking about, as soon as I retire, I'll move? You might want to pause on that before you make that kind of a decision. All of our mentors are retired faculty who volunteered to serve, and they've all undergone a structured training session provided by faculty staff assistants and the retirement mentoring program chair, which currently is me. The pairing of pre-retirement faculty with a mentor is not a very complicated process. I ask both groups, both the mentors and those seeking a mentor, 3 real simple questions. What is your academic department and specialty? What interests and activities do you enjoy? And what do you do in your spare time? And it says in the email, if it takes longer than 5 minutes to answer these questions, you are overthinking it. Just the basics. And then what I do is I compiled all these responses from the mentors and have established a kind of database, so that when a request for a mentor comes in, it goes to it's done through the Emeritus College, and then I'm notified that someone wants a mentor. And so I send you, if you want a mentor, I send you those 3 questions, and then I look at the characteristics and habits and likes and dislikes of my mentors, and try to do a pairing that would maybe where there's some overlap of interest. And generally you'll get at least 2 and sometimes 3 choices depending. And then after, then I put you in contact with I give you choice, you tell me which one you want, and then I put you in contact with your mentor, and your mentor gets your contact information. And after that, it's up to you to set up a time to meet. Now, we used to recommend the initial meeting at the Luce Center. The initial meetings in the last year have pretty much been over Zoom. But as things open up, if both parties are fully vaccinated, and with the masking rules having changed, you can probably find a place that's mutually agreeable to meet initially. If you're not comfortable with that, Zooms and phone calls certainly work. And then after the initial meeting, you mutually agree when you're going to meet again. The mentors can refer you to faculty staff assistants if you have questions about financial concerns or health insurance choices, or assistance with psychological or emotional issues. Our goal is to help you considering retirement, to come to understand that retirement can be satisfying, and that the opportunities allows opportunities for things that are not available to you while you're working full time. We have 14 active trained mentors, and we have mentored 51 pre-retirement faculty. And as far as I know, no one has been dissatisfied with the process. We've made friends. In conclusion, I think that having one-on-one confidential conversations with a peer who has been through the process of taking the leap from the known to the unknown and who enjoys being retired can help you realize that there is indeed satisfying life after retirement.
So I will now briefly talk about Emeritus Status. that's something that has come up several times, and there's not, I think a lot of faculty don't quite understand the process. So this is defined in the Gray Book, which is a statement of principles governing faculty relationships. Point 11 says a retired member of the faculty who has reached age 55 and has served a member of the Emory faculty for at least 10 continuous years and whose total age in years of continuous service equal at least 75. Now that is the formal requirement for retirement. And so if you don't meet those requirements, you actually can't officially retire from Emory. And the reason I say that, actually one of our most distinguished members in the Emeritus College spent the last part of his career at Emory, but actually quit rather than retire because he had not been here for 10 continuous years. He served at NIH as a scientist and then came here and did a lot of incredibly good work, but he actually didn't fulfill these requirements. And so those are the requirements for retirement. And if one has done that, they may be considered for an emeritus title that reflects rank and appointment track at the time of retirement. Following rules and guidelines for academic titles, the dean of the academic unit where the faculty member's appointment is housed may recommend a faculty member to the provost and executive vice president for academic affairs, and the president who shall inform the board of trustees is awarded. So that's the official statement. Now, there are several things to note. The process is not automatic. So the dean may recommend, but is not required to recommend. The process actually generally begins with the department chair for schools and colleges with departments. And sometimes those may need reminding, particularly in very large departments. If you're planning on retiring, you might remind your chair that you would like to be considered for an emeritus title. It's not restricted to tenured faculty. So that is a change that was made so that faculty on the lecture track, faculty in non-tenure track positions can and frequently are given emeritus status. The procedure can take many months, so it's important to remind your chair early. And if the process is not started timely, one can end up retiring without emeritus status. If there's not too much of a gap, that can eventually happen, but it's really something that you would prefer not to happen if at all possible. The Academic Affairs Committee of the Board of Trustees does vote on the recommendation. So that's one difference in what the Gray Book says and the actual practice, is that the board is not just informed, the board feels like they have to take care. And another point is that the Emeritus College itself, we have nothing to do with the awarding of emeritus status. We do not require emeritus status for membership, and that's why we can and do welcome faculty as members before retirement. But we have nothing to do in the process. It's also something that you really want to get, if at all possible, because there are certain advantages. To emeritus status that only faculty with emeritus status have. No other retired employees have, and those particularly are associated with access to the online resources of the library. So any retiree can go into a library and work with the online resources, but only those with emeritus status can get online or maintain online access. And I see there is yes, Robert has a question.
Yes, thank you very much. I wanted to ask about part-time employment by Emory after retirement, and does that complicate the emeritus situation, and does it complicate the healthcare situation?
It doesn't complicate the emeritus problem. One would get at retirement the emeritus status. And so if one then is rehired, one still has that status. And I wouldn't say it complicates, but, and so this, in fact, is exactly what I did. I retired 2 years ago from my faculty position and then was rehired in a half-time position to continue on as director of the Emeritus College. And so when I retired and in up to that, I was awarded emeritus status. But then when I was rehired a day later. I went back on the Emory healthcare plan. And so I'm still on the Emory healthcare plan. And then when I retire from my position as director of the Emeritus College, I will then go on to Medicare. So, and if you were rehired in a position and it was part-time, but you didn't want to take the employee plan or weren't eligible because you weren't at least half-time, then you would just go on Medicare. And I also noticed you were interested in how to get the healthcare newsletter. I'm going to send out an email to everyone who registered for this with options. And one of the options is to request the healthcare newsletter, and I'll send that out. That's not something we post on our website, in part because we don't want to run into any sort of conflicts with what we say about via benefits or Medicare Compare or anything. We want to be able to sort of say things that we wouldn't want to necessarily publish on. And I got another chat question here. Is there a wait time required between retirement date and a rehired date as part-time? And I was rehired the day after I retired, so that can be arranged. It just depends, I think, on how that works, but there's no official policy on that. Are there other questions? Okay. I think, Gretchen, did you want to say anything about any other Emeritus College programs?
Yes, hello to everyone. In 2011, my God, 10 years ago, I can hardly believe it. It was only that year I discovered the Emeritus College existed. They asked me to come and talk about Shakespeare, and I thought, well, this is interesting. This group, I'll have to look into it. And before I knew it, I was in charge of scheduling speakers for our lunch colloquiums, breakfast and lunch colloquiums as they were then. And this is a thriving program. I think, one of the very best things that the Emeritus College does. I'm working now with a co-chair, Holly York, and a committee of 5 working on scheduling, because when COVID came along, we went from scheduling these speaker sessions twice a month to scheduling them every week. We're in the process now of scheduling speakers for the 12 summer slots for speakers that we've got coming up. These are a wonderful illustration of what's available to all of us through the Emeritus College, not just the chance to volunteer and help arrange programs of this sort, but just to attend programs that offer wonderful collegiality, for one thing, and that's so important, I think, when we've lost touch with our usual colleagues, when we retire and that group of people is not readily available to us anymore. But that group of people was probably relatively small. And what we've got in the Emeritus College is a huge group of people still interested, not just in getting to know one another, but just getting to know, period, right? And learning and the pleasures of learning and learning from, for instance, these speakers that we bring in on such a wide range of topics. And of course, the people who attend, and this year we've typically had 60, 70 people or more attend once a week, come once a week to hear these speakers. And the attendees are from a wide range, the widest possible range of disciplinary areas, different units of the university, faculty, administrative staff. We have quite a few people attend to represent other institutions in the area. It's so interdisciplinary. And the speakers discover that, know that sometimes before they come to speak, but soon discover it. And we always allow a generous chunk of time for questions and answers, because with so many attendees coming at subject matter from so many different areas of expertise and experience, these question and answer sessions are really something. Bona Westcott, I quote her often because she got into the middle of one of these question and answer periods and she just stopped suddenly and she said, "These are the best questions I have ever had." and I think we experience it that way, and so once a week, that's an example. We get together, 60, 70 of us maybe. These are people, we are people who might have spent 30, 40 more years as Emory employees, right? Teaching, doing other sorts of work at the university, and never met most of the people at the university, right? And in the Emeritus College, with this very interdisciplinary interaction, you get to mix with all kinds of people from all areas. I mean, it's a real intellectual home as well as a social home. I often think of it in connection.
Okay, thank you, Gretchen. And I know Mike Kuttner and Jim Keller, two of our members who are here. Do either of you want to add anything to what's been said?
Jim, are you going to add anything? I'll just add that I'm semi-retired. I was awarded Emeritus Status when I left Emory for 6 years to visit the Cleveland Clinic Foundation as a chair of a department there. And so when I came back, they didn't take the award away from me. And so I'm half-time. I work more than half-time, but at any rate, I don't have a retirement date, so I don't qualify for getting some awards like that's the Emeritus College grants for distinguished service and et cetera, because I'm officially not retired. So you can do this. Gray, I'm glad to hear what they did with you. It was interesting because you actually have a retirement date and then you signed up again. So you are officially retired at that date. So
check it out.
And
Jim,
I see that John Heller has a question. So
yeah, hi. First of all, thank you for taking us through all of this. It's very helpful information to be looking down the calendar. My question pertains to things like the Emory group term life insurance policies, group disability policies, and that sort of thing. And whether after age 65 they still apply, whether after retirement we still have the option to continue to use those and pay the annual premiums, or do they sunset with our retirement?
So one interesting thing that I think a lot of retirees are not aware of is that no matter whether you were paying for any life insurance or not, all retirees have a life insurance policy. I think it's something like $10,000. And so once HR finds notice of a retiree death, they will track down the beneficiary. So there is that is available. One can get the dental plan and vision plans and continue those in retirement. There is a booklet on the HR website for retirees pre and post 65 about the various things that are available in retirement. And so I'm not sure about those particular plans. I would have to look and see what they say about those particular ones, and I'm not sure. I don't know if anyone else knows the answer to that.
Yeah, I don't know if Bob Guyton does or not, but most private disability policies cease paying any benefits after age 65 unless you were retired as a function of injury, and then they generally pay off for life. So even if you were working after age 65, it'd be interesting to know, does the Emory group disability policy continue to cover you, or is it sort of meaningless once you hit 65?
I think if you were still employed at Emory, it would cover you. But I don't know the answer to that.
Bob, you know anything about that?
No, no, I don't. Maybe I should raise the question.
Yeah, I mean, in the world of orthopedics and spine, we deal with that all the time with patients and then, with colleagues, right? But it is a kind of a funny way that those policies apply. I would assume if you're still working at Emory and became disabled by injury after age 65, that the benefits would pay off for life. But if you became disabled by illness after age 65, there's probably no benefit at all. But I'd be curious to know, because otherwise we wouldn't want to be electing to pay the premiums.
Right, and I don't know.
Okay.
Those.
There's some other questions.
So one question, are retirees allowed to audit classes at Emory? And yes, absolutely. And I know one of our members has audited a number of classes. She has taken several visual arts classes and music classes and so forth. And so that's definitely something that can be done. Of course, in terms of auditing, it's always subject to the okay of the person teaching and so forth, and it's not automatic, but it's definitely possible, and I know some of our members have. And the Faculty Staff Assistance Program is part of HR. I think they are located in the building on Clifton down the hill past CDC on the left as you're going down the hill on Clifton. I think that's where they're located, but if you Google Faculty Staff Assistance Program, I think you'll find them there. And if you have any trouble finding that, if you send me an email afterwards, I'll be glad to give you their contact information on that. And does the part-time rehire obtain the same benefits as full-time? And the answer is, in terms of healthcare, for example, no. That I think you have to be at least half-time, and then you can get full healthcare benefits, but you pay more than you would if you were full-time. So whether you consider that the same benefit or not, you're paying more for it. Other parts of the benefit, yes, I think. Again, it depends on the cutoff may be whether you're half-time or not, but as a half-time employee, I have full access to the library, to the online resources of the library, to vision and dental insurance and other things like that. And I don't think that there's any benefits that I don't have access to. It would just be a matter of cost. And what I will say is, if there are questions you have and they're not fully answered, if you will email me, I'll be glad to sort of track down the answers to those. That's one of the things that I try to do, is to be a resource for questions on retirement, because a lot of times departments are not very good about understanding issues involved in retirement. And so I try for our office to be the repository of that. And so I'm certainly very interested in trying to give the right answers to those. So just email me and I'll be glad to try to track down what I can about questions like that.